All right, let's do this. The question today, let's do a prioritization delegation because I feel like we get a lot of people saying that that is something they struggle with. So we're over at nursingpracticequestions.com. We're in nursing prioritization delegation, and let's start practicing. This is live, guys. Let's see if I get this one right. Let's see. Oh, shoot. Select all that apply. All right, let's see how we do. A nurse is preparing to start her shift at the hospital and is considering which patients are highest priority for her to see first. All right, these ones are always a doozy here. Let's see. Which of the following patients would be considered second level priority for the nurse to see? Select all that apply. All right, so that's a little tricky there. So this question is specifically asking who is second level priority. So who do we not need to see very first? A patient who requires a ventilator to help him breathe. Okay, let's look ABCs there. Airway, pretty important. Patient who's going into cardiogenic shock. All right, that's pretty important. A patient who has low blood sugar. It doesn't tell us how low, so we got to be careful about reading into that one. Patients who has had a mental status change. Okay, that could be, due to stroke or something like that. A patient who has developed severe peripheral edema. Okay, severe peripheral edema. I'm thinking that's some volume overload. So let's do ABCs on this one. That's what I'm going to try to see if we can get this one right using ABCs. So, patient who requires a ventilator, airway. Going to cardiogenic shock, circulation, mental status change. Mental status change, my concern with that is that's one of our major body systems, right? That could be the patient's having a stroke, the patient's blood sugar is really low, but what we know is they're having a mental status change, okay? With the low blood sugar, it doesn't give us much more information beyond that, so that could be something as simple as, just... It could be a blood sugar 59 or something like that. Severe peripheral edema. It says severe, but let's go with these ones. Okay, so we're talking about second level priority. So let's choose the ones that don't have airway, breathing, circulation. Let's see how we do, you guys. Incorrect. Let's see what the rationale is for this. Low blood sugar. Okay, I agree with that one. Mental status change. That's tough. Has developed severe peripheral edema. That's the other one we checked. So let's see what the rationale says here. A nurse must establish priorities that are based on conditions of the patient she cares for. Second priority situations are those that could wait for care after the nurse manages first priority conditions of managing patients' airway, breathing, and circulation. Second priority situations are not life-threatening but could cause severe complications for the patient if they are not treated soon. So that one's really tough, guys. I mean, if we had stuck with the framework that we were going with ABCs, then we could have excluded the mental status change. And I guess part of it is me coming from being a neuro ICU nurse that, man, we're on top of mental status changes like nothing else. For us, it's as big as ABC. But if you go with your ABC framework, you guys, it's going to be mental status change is not as critical as ventilator and cardiogenic shock. So when you do ABCs, if you focus on that, and yeah, we want to get our patient on a ventilator so they don't stop breathing. And our patient who's going into cardiogenic shock, go into just complete cardiac decompensation. And so if their heart doesn't work, if their lungs don't work, they can't live. If they have a stroke, they can still live. So yeah, I mean, take care of those ABCs, and then let's look at our mental status. And then from there, I would do blood sugar, and from there, I would do the peripheral edema. So that's a tough question, guys. Let's see. Only 23% of people are getting that one right. I gotta say, that's a tough one, but I think, that's the right answer. If you look at what's going to cause death, it's, the airway one and the circulation one, where mental status change, they're gonna live, but not gonna be comfortable if it were due to a sudden onset stroke or something like that. All right, tough question there, guys. Select all that apply. Hopefully that gives you some framework for how to answer these questions. And if you need more practice, you want to select an area you struggle with, head over to nursingpracticequestions.com.